Powered by the Montana Television Network. This is the 5:30 News on Q2, Montana's news leader.
Good evening, everyone. Thanks for joining us on your Friday. I'm Jeanelle Slade. In about 6 hours, Montana moves inside as the governor's stay-at-home order goes into effect at midnight. This as America now tops 100,000 confirmed cases of coronavirus, and we learned the highly contagious virus has claimed more than 1,500 lives. And tonight we now know the first Montana death is out of Lincoln County. Health officials are not releasing any other information at this time, but we have learned the victim, 77-year-old Jim Tomlin, a retired Washington State teacher, was one of 3 confirmed cases in Lincoln County. Tomlin is from Libby. Today we spoke with his son.
He never stopped being an educator. He never stopped learning. He always wanted to teach. And if this is his last lesson, hopefully it saves lives. He would be proud to know that he affected people enough to change their behavior for the better.
As for the latest numbers, the major jump happened overnight. As of that last update just about a half hour ago, Montana now stands at 121 total cases. That's a 31 case increase from last night alone. 3 of those cases right here in Yellowstone County, bringing its total to 23. Also, at least 3 of those cases are from Gallatin County, totaling 42 now. Montana has seen more than 5 times an increase since last Friday when the state was at a 22 total caseload. There has been 1 death and 7 hospitalizations so far. Of those 121 COVID-19 cases, 23 are from right here in Yellowstone County. Q2's David J. joins us now with more information on those patients. David.
Jeanelle, according to the Unified Health Command, an 80-year-old man is the only person hospitalized in Yellowstone County, and he is in stable and in fair condition. It also has more information about 22 of those patients. 2 were people who traveled internationally. 2 also traveled domestically. 7 had contact with someone who had a confirmed case of coronavirus. And with 7 of the cases, the exposure is unknown, and 4 cases are still under investigation. 11 males and 11 females have tested positive. 1 teen and 2 people in their 80s are on that list. The biggest age groups are 6 people in their 20s and 8 in their 50s. Meanwhile, Yellowstone County Health Officer John Felton said the rise in cases of COVID-19 in Yellowstone County is likely due in part to increased testing. Some of the individuals testing positive have unknown exposure, and therefore we have made the assumption that we have community spread of COVID-19. John Felton says because of this, it's especially important to follow the governor's directive and stay home whenever possible and stay 6 feet away from others if you leave home. Jeanelle?
All right, thanks so much, David. Well, we've received a slew of questions here at Q2 about enforcement of the governor's stay-at-home order. To get out in front of tonight's midnight implementation, we touched bases with Police Chief Rich St. John to clarify some things. Now, St. John says the Billings Police Department is also inundated with calls because people are nervous and scared. Now, the BPD, the Yellowstone County Sheriff's Office, and the Laurel PD will all enforce the governor's order. People need to stay at their homes, only go out for what is considered essential work, necessary supplies and services, or to care for someone in need of care. Outdoor recreation is also permitted, but make sure to maintain social distancing. St. John says police will write citations for those who blatantly disregard the law, but this is not martial law.
The governor's order is not a martial law order by any way, shape, or form. And I think some people are interpreting it as that. It's very clear that there is some movement allowed, and we just hope people will voluntarily comply.
Now, St. John says law enforcement is not approaching this order with an enforcement mindset. This is a public health matter, and he says we are all as good community stewards. Well, all complaints of these stay-at-home order violations should be directed to the public health line at 651-6415. All complaints will be taken. Callers should not expect a call back unless there are additional questions. Earlier today, word came down with changes regarding recreational outside activities all across Billings. Q2's Scott Breen has the latest on that.
Well, that's right, gang, hanging out down by the Yellowstone River among the trails and a handful of people trying to catch a little fishing. It's one of the few, all of a sudden, as of this afternoon, recreational places still open to the public. City of Billings this afternoon announcing effective immediately All city playgrounds, tennis courts, volleyball courts, and basketball courts are closed until further notice due to the possibility of spreading COVID-19. Now, to clarify, city parks themselves, plus spaces and trails, are open for public use. It's just specifically the playgrounds, the tennis courts, volleyball, and basketball courts that are closed until further notice. So keep that in mind as you head out this weekend. It's okay to get outside, get a little exercise and some fresh air. You just can't be specifically in those city areas that were mentioned moments ago. That'll do it from down here at the Yellowstone River. I will be back coming up in sports just a few minutes from now.
All right, thanks so much, Scott. Well, staying home is an important step to keep COVID-19 from spreading and possibly overwhelming hospitals and healthcare providers. But that doesn't mean everyone should avoid healthcare facilities. In fact, for some people, it may be more important than ever. Q2's Russ Riesinger connected with a local doctor today and joins us now from the newsroom with some very important information. Russ.
Well, the COVID-19 outbreak has certainly changed life for all of us, and that's especially true for our local healthcare providers and the way that they're now doing their jobs. It's also changing the way that many people now visit their doctor, and that's important that you continue to do that even though you are staying at home.
The last week, we have probably shifted from seeing 100% of our patients in our offices to now all of our providers are probably seeing 1/3 to 1/2 of their patients on an iPad, just like you and I are visiting right now. So there's been a big shift. People are understanding the technology. It's much easier than they thought. And we're able to do virtually everything other than lay our hands on patients and take care of their chronic needs.
I'm taking part in a virtual office visit with Dr. Scott Sears, the medical director of primary care at St. Vincent Healthcare. While he's urging people to stay home and wash their hands, he also wants to make sure that they keep in contact with their healthcare provider, which may be more important than ever for some patients as the COVID-19 virus continues to spread.
And we have so many patients with chronic illnesses, underlying cancer, heart disease, emphysema, diabetes. And we know that when those patients get this COVID virus, their outcomes are way worse. And when those folks stay away from their providers, those underlying conditions get worse. And then when they are going to get exposed to the virus, their outcome's going to be worse. And we have our own campaign, which is stay at home, but still stay in touch with us virtually through these MyChart video visits.
Dr. Sears says it's also important for those who are healthy to take this outbreak seriously.
It's not something to play with and think, hey, I'm young. If I get this, it's not going to be a big deal. If you get this and you're young and you visit your grandfather or you visit your father who happens to have an underlying medical disease and give it to him, you're sure going to feel bad about it. So it's not a time to minimize the recommendations that people are receiving. And it's also not a time to minimize your interaction again with your healthcare provider. It's so important to take care of your healthcare needs. Make sure you're in as good of health as possible, that you're participating in self-care so that when you are exposed to this illness, your immune system can fight it.
Now, Dr. Sears says that we are fortunate here in Montana that we've been able to learn from some of the other problems that other states are now experiencing. And he says that both the major hospitals here in Billings are very well prepared. Jeanelle, back to you.
All right, thanks so much, Russ. Great information. Well, what risk do pregnant women face? It's a question that seems to have no clear answer as doctors and nurses navigate what they know so far about the virus. As Q2's Andrea Lutz reports, hospitals like Billings Clinic now restrict visitors and only allow one support person in the labor room.
Well, I naturally had some questions about COVID-19 and pregnancy because I myself am in my second trimester and staying at home, working at home. But because there's so many questions out there and so many unknowns, I decided to talk to a doctor at the Billings Clinic to get some perspective.
Unfortunately, right now, we don't know a lot about COVID-19 and pregnancy.
And that's probably the most troubling part. OBGYN Amy Hopstad says there's just not enough data coming out of China about the virus so far.
What we do know with other respiratory infections, things like influenza and prior SARS outbreaks, pregnant women are more vulnerable and tend to get sicker. So we're taking extra precautions to keep our patients safe.
Pregnant women experience a decrease in their immune system, and that naturally makes them vulnerable.
Your immune system goes through a lot of changes in pregnancy, really to protect the developing fetus. And so your immune system kind of gets put on the back burner a little bit. That and there probably are some other physiological changes that happen in the lungs and things like that and make respiratory illnesses especially potentially more serious in pregnant people.
So because of that, Billings Clinic is taking precautions.
Now we have more visiting restrictions than we ever used to have, in that, kiddos under 18 aren't allowed. You get one support person, and that person for now is allowed in the labor room and postpartum and can stay here with you.
So for now, safety, they say, is the best policy until health professionals know more.
Honestly, all of us are a little bit uneasy with it, just because we're hearing other case reports from other cities that are harder hit. And it's hard for everyone. So just to be careful. The fortunate thing is most pregnant women are young and healthy, and for the most part should do fine.
So while there are some restrictions at hospitals here, Hopstad says she doesn't anticipate Montana doing what other states have done, like New York, where no support person is allowed in the labor and delivery room. In Billings, Andrea Lutz, MTN News.
All right, thanks, Andrea, and stay safe. Now, COVID-19 is also weighing on people's minds, so we talked with a neuropsychologist who has some helpful advice for anyone struggling with anxiety.
Trying to keep some normalcy in their life as best they can in these, kind of strange times, and to recognize that the emotions they're having are normal reactions to abnormal experiences. And so really looking at, whatever they can do in their day-to-day life, keeping some type of a structure and a routine that they that they can do within their daily life, making sure that they're still contacting people and staying connected with people via phone, via, FaceTime, whatever technologies that they can utilize in that way. Taking care of their personal health, so making sure they're eating healthy and trying to stay away from as much processed food as possible. Getting in movement and exercise, even if that's, doing things at home inside, but preferably if they can just get outside, walk around the block.
Get outside. Well, President Trump signed the CARES Act this afternoon, the biggest economic relief package in U.S. history at $2.2 trillion. Broken down, of the $13 billion set aside for education, a certain amount will go to Montana education. State School Superintendent Elsie Arnson stopped by the station this afternoon. She answered the question on many people's minds. At what point will students not be able to satisfy graduation requirements?
We have in rule and in statute that it's up to the local trustees to be able to determine what graduation means. So that means that the requirements that are set can be waived by a trustee's motion and a vote. So it can happen differently across our state. Of course, with social distancing, it's going to be very challenging to have that great celebration that we have traditionally had in graduation, but I have no doubt that our communities are going to celebrate.
And $41 million will come here to Montana. And in Wyoming, school and business closures have now been extended through April 17th. Well, here's something to keep the kids busy. Enjoy all that's offered at the Billings Public Library online. There are plenty of free activities and learning opportunities. Virtual tours are on the library's main children's page. Explore zoos, aquariums, national parks, all to help shake off that cabin fever. Now we hear the virtual tour of Dry Tortuga National Park is a must-see. The website is billingslibrary.org, and for other questions and resources, you can always send a message to the Billings Library on Facebook. Straight ahead on tonight's 5:30 News, sometimes the best medicine is simply stepping outside and taking in the fresh air. We get to check in with Q2's Jay Cohn for his ideas.
As we've been saying, just because you have to stay at home doesn't mean you need to stay inside. Temperatures very pleasant today, hit a high of 49, and it'll be the coolest day of the weekend. Details on the forecast coming up.
You're watching MTN News with Jeanelle Slade and Russ Riesinger. Storm Tracker weather with Bob McGuire and sports with Scott Green. This is the 5:30 News on Q2, Montana's news leader.